Hi, my name is Ronnie Davis. This is Modular 6 assignment for Foundations, and I chose to talk about Scenario 13. Mr. D is a 55-year-old man that was born January 5th, 1950, who was picking up a bag of cat litter after cleaning his litter box when he experienced pain. He had immediate pain to the lower back, and within an hour, pain was radiating down the posterior aspect of the left leg and to the foot. He come in for an evaluation 2 days ago and was unable to complete the full evaluation because of pain. He had no weakness on evaluation, but his left ankle deep tendon reflex was slightly diminished. Both flexion and extension movements produced pain. However, the flexon produced greater pain. No clear centralization was achieved. He returned today with a 9 out of 10 pain. When he was placed on a bike to try a warm-up, he noticed that he didn't feel the seat very well. He is a little hesitant to ride and distressed because last night he had an episode of bowel incontinence. He feels this happened because he has been pushing so hard trying to urinate the last couple of days. He just pushed too hard when he coughed. He feels that if the bike makes him cough, it may happen again. The bike does not change his pain, and he has no demonstrated weakness today. On further treatment, repeated movements did not improve his pain or symptoms. He does not centralize and continues to report numbness to his inner legs bilaterally and groin area. His left leg pain continues to radiate down the posterior thigh into his foot. Pertinent data from the scenario includes patient had immediate back and leg pain, numbness in the buttocks, bowel incontinence, trouble urinating, repeated movements did not help, and he is still in pain. So now I'm going to call the doctor. Ring, ring.
Hello.
Hi, doctor. My name is Ronnie. I'm calling in regards to Mr. D, a patient we have here at UNC Health. He initially came in with lower back pain radiating down his left leg, and his estimated pain level is 9 out of 10. Evaluation and rehab was cut short due to the patient's pain. Both flexion and extension movements are causing him pain. However, the flexon is producing greater pain. He is now experiencing bowel incontinence and trouble urinating. This could be a neurological issue. With that being said, I would like you to see him as soon as possible before any other issues occur.
Okay, I will be in shortly. Is there any other information about the patient I should know about, such as recent falls or injuries?
No, he has no recent falls, just started experiencing the pain after he picked up a bag of kitty litter. Would you like for me to start any tests such as spinal x-rays, MRI, or EMG?
Sounds good. No, don't start any tests yet. I'll be in shortly to evaluate. It sounds like he may have pulled something in his back and may have injured his sciatic nerve. After evaluation, we may proceed with those tests.
Okay, thank you so much, doctor. So I think the given pain and where the pain is, Mr. D could have possibly pulled something when picking up the cat litter. It could be a sciatica nerve, but I think further evaluation and testing would need to be done to accurately diagnose Mr. D's issue. If after tests such as spinal x-rays, a MRI, or EMG are performed and it indeed does come back to be a true injury to the sciatic nerve, which is used to describe any pain that originates in the lower back and radiates down the leg, and you can also experience mild to severe pain anywhere from the lower back through the hips, buttocks, and down your legs. It can also cause muscle weakness in your legs and feet and numbness in the legs. Having an injury to your lower back or spine puts you at a greater risk for the sciatica. Treatment for Mr. D, if this is the case, could be prescription medication and physical therapy. Spinal surgery is not recommended unless you have not improved with other treatment methods such as stretching and medication. If your pain is getting worse, or you have severe weakness in the muscles in your lower extremities, or you have lost bladder or bowel control. Some thoughts on the clinical scenario. I think for the most part it was realistic. In reality, though, I think tests would have already been done and pain management would have already been in place. Things that could have been added to the SABAR is Mr. D's current medications, any known allergies, other labs he may have had, and his vitals. Things not needed in the SABAR, I don't think I would take anything away from the SABAR. I feel all the information was pretty pertinent to the scenario. I think the information was presented clearly to the physician. And after the physician evaluating the patient, if it is a neurological issue, as I had stated, Mr. D may require surgery, rehab, and pain management. And if we did this conversation again, I feel we could use a little more background information on Mr. D. Thank you.